All right, so today we're diving deep into some really heavy but absolutely essential topics: crisis, grief, and violence. We're going to go way beyond just textbook definitions to create a visual map, a sort of pathophysiology of how these experiences unfold in the mind and body, step by step. This isn't just to get you through your exams, this is a framework you're going to use every day in your clinical practice. So here's our game plan. First, we'll lock down a solid definition of what a crisis really is. Then we'll trace its patho, if you will. From there, we'll see how that same kind of thinking applies to navigating grief and understanding the cycle of violence. And we'll wrap it all up by connecting the dots directly to your role in assessment and intervention. By the end, you'll see how it all fits together.
Okay, let's start at the beginning. Before we can even think about jumping into help, we need to have a really clear clinical definition of what a crisis actually is. And remember, this isn't some formal diagnosis. It's a state, a moment in time that anyone, literally anyone, can find themselves in.
The two most important words on this slide are temporary and disorganization. A crisis is not a chronic condition. It's an acute, short-term thing where a person's usual toolkit, their go-to coping skills, just get completely overwhelmed. Think of it like this. Their normal problem-solving ability is, for a moment, totally offline. Okay, this slide right here, this is huge for your exams because it helps us classify what triggered the crisis. First, you have a maturational crisis. This is tied to predictable life stages, things like getting married or having a baby. Then you have situational crises, which are those curveballs life throws at you: an unexpected job loss, a divorce. And finally, there are adventitious crises. These are the big, unplanned disasters, things like a hurricane, a violent crime. Knowing the type really helps you frame your whole approach. So now let's trace what we're calling the pathophysiology of a crisis. This is the sequence, the step-by-step progression of how a person actually moves from being okay to being in that state of total disorganization. You can see the whole cascade right here. It all starts with an event. That event is seen as a threat, which causes anxiety to spike. Now, this is the moment where coping skills should kick in, right? But in a crisis, they don't work. They fail. And that failure leads to disorganization. It's only after that breakdown that the person starts mobilizing resources. Let's look at how one step triggers the next. So in these first two phases, the person is really trying to solve the problem. The thing happens, their anxiety shoots through the roof, and they immediately reach for their usual coping mechanisms. But in a real crisis, those tools just aren't cutting it. It's like trying to put out a forest fire with a garden hose, and that anxiety just keeps climbing and climbing. And this brings us to the tipping point, phase 3. This is where the dam breaks. The coping mechanisms completely fail. The person becomes severely disorganized, and you might even see physical symptoms. This breakdown is basically a signal flare that triggers phase 4, mobilizing every single resource they've got, both inside themselves and from the outside world, to try and get back to some kind of balance. Okay, now let's take this same kind of process-based thinking and apply it to grief. Now, grief isn't a crisis in exactly the same way, but it's an experience you will see constantly, and it absolutely follows its own predictable internal journey. You can think of the grief response as a natural healing process. First up, you have stage 1, shock and disbelief. This is like a psychological buffer. That numbness protects the mind so it doesn't get totally overwhelmed at once. Then comes stage 2, and this is the hard part: experiencing the loss. This is where all those messy, painful, but completely necessary emotions, like anger, guilt, and depression, come to the surface so they can be processed. And finally, after all that work, you get to stage 3, which is reintegration. This is where the person starts to accept the new reality and actively rebuild their life around it. All right, now we have to shift gears and look at a much darker, but sadly just as predictable pattern. The cycle of violence has its own destructive physiology. It's a repeating sequence that is psychologically designed to trap the victim and keep the abuse going. And this diagram, it just perfectly illustrates the trap. This isn't just a theory. It is a map of psychological manipulation. The cycle has these 3 distinct phases that just feed right into each other, creating this powerful trauma-based bond that makes it incredibly, incredibly difficult for a victim to leave. Let's break down each part. So it starts with the tension-building phase. The victim can feel it, that feeling of walking on eggshells. That tension explodes into the battering incident. But the real key to the trap, the most insidious part, is phase 3, the honeymoon. The abuser suddenly becomes loving, apologetic, making all these promises. And that creates this powerful false hope that things will finally change. That hope is the psychological glue that resets the cycle and keeps the victim locked in.
Okay, so we get the pathophysiology. We see how these cycles work. But what do we do about it? Let's turn all this theory into action and focus on your specific role in assessment and intervention. These are the absolute must-knows. To really intervene effectively, you have to understand the psychology going on here. Abusers often have incredibly low self-esteem and massive dependency needs. Victims, on the other hand, feel trapped, powerless, and over time, their own self-esteem gets so eroded that they often start to believe it's their fault. Recognizing this dynamic is so fundamental to giving non-judgmental, empathetic care. Okay, pay very close attention here because this is your action plan. These are non-negotiable. Number 1, you are a mandatory reporter for any suspected child or elder abuse, period. You have to create a safe private space for them to talk. Even if they tell you they're not ready to leave, you help them create a safety plan. You arm them with resources. And you always assess for lethality. That means you have to ask direct, hard questions about the risk of them harming themselves or someone else. When you're assessing children, your radar has to be on high alert for these red flags. For physical abuse, you're looking for injuries that don't match the story, especially things like spiral fractures. Those are hugely suspicious. For physical neglect, the signs are more subtle but just as serious. Poor hygiene, not gaining weight, always hungry, these are things you cannot afford to miss. And please remember that the deepest wounds are often the ones you can't see. The signs of emotional abuse are often behavioral, a new speech disorder, a learning problem that came out of nowhere. For sexual abuse, you might see physical cues like difficulty sitting, but also look for those behavioral changes like a kid who suddenly refuses to change for gym class. These hidden signs are why your assessment has to be so thorough and so sensitive. Finally, let's talk about what is probably one of the highest stakes assessments you will ever have to make. When a patient is in crisis, your suspicion for suicide has to be high. So what are the critical warning signs that you absolutely positively cannot miss? This list here is a must-know. Memorize it for your exams and for your patient's safety. Some are obvious, right? Giving away stuff, making direct threats. But I want you to zero in on the one that seems backwards. A sudden calmness or improvement in a person who's been deeply depressed. This is a massive red flag. It doesn't always mean they're better. It can mean they've made a final decision and now they feel at peace with it. So as we wrap this up, let's come back to this big idea. A crisis is a moment of total disorganization. It's terrifying, but it is also a turning point. And by understanding the pathophysiology, by recognizing the signs, by knowing when and how to intervene, with skill and with empathy, you're not just managing a crisis, you are creating a powerful opportunity to turn that moment of breakdown into a moment of healing and growth that can literally change the entire rest of a person's life.